Now, the interstitial. During your anatomy histology time, which took 2 years, right? 2 years, which means that you should be able to remember every single cell in your body for the 2 years that you have done, which is never done in any university. Other universities would do 1 year only. So if you don't remember your anatomy, your histology, it means that you have not been reading your textbooks. Now we are doing diseases. Without normal, you will not understand diseases. So please keep your normal histology, pathology, normal anatomy one side while you are studying pathology. So this is the interstitial. You probably may not recall what is the interstitial. The interstitial covers they make the alveoli, the wall of the alveoli. Your lungs are full of alveoli. That's how you survive. That's how you live. You need these alveoli to take in air and oxygen from the outside and to exchange what you have produced from your body to remove that. So without this alveoli, you will not live. So these alveoli are very thin, very, very thin. But look at them. Okay? This is my drawing. You can't find it in any textbooks. So if you look at this thin, very thin alveolar wall, you find that there are capillaries, numerous capillaries. Within the capillaries, the blood, the red blood cells, neutrophils, eosinophils, monocytes. Monocytes will move out into the tissue to form macrophages. So you find macrophages and supporting cells like fibroblasts producing. What do fibroblasts produce? What do fibroblasts produce? What? You mumbled. The one answer, what do fibroblasts produce? Collagen. Okay? Fibroblasts produce collagen. So you get collagen from fibroblasts here. You get laminin, all sorts of supporting tissue. And what is the anatomy of your alveolar lining? What cell? Squamous cells. You are still taught squamous cells. Have you been taught of type 1, type 2 pneumocytes? Yes. Okay. So there are type 1, type 2 pneumocytes here. And at this level, you should be thinking of type 1, type 2 pneumocytes, which are regenerating and repairing the wall of the alveoli. Okay, let's go into the disease itself. There are two big topics here, interstitial disease and vascular disease. So now focus on this one, interstitial disease, properly before we go into the vascular disease. We talk about interstitial. Those little tiny things, those interstitial can bring a lot of problem. They have got a lot of diseases that affect them. And what are they? These diseases, they infiltrate, they destroy the interstitium, and the alveoli, from being expandable, they become rigid and restrictive. So we call them a restrictive disorder. And these tend to affect the whole lung, sometimes not sparing even a bit of the lung, because they are caused by something that you inhale, something that you are exposed to, that goes into your respiratory system. So it affects the whole respiratory system. Now, this disease, since they are restrictive, to prevent the alveoli from expanding properly, from constricting, expanding properly. They are restrictive. So what do you get? You can't breathe properly. You get dyspnea. You get tachypnea. Are you familiar with these terms?
Yes.
Lung physiology?
Yes.
And if you auscultate, you hear your lung. There are crackles. When you listen to your lungs, you can hear fine crackles. So that shows that there is something like some kind of fluid maybe inside the alveoli, or the lung is forcing air out through some kind of secretion in fluid. So you get this crackle sound. What happens? So what is the effect on the lung? So sometimes your question comes as effect and sequelae. Yeah? So remember, effects is what happened to that organ, as a result of a disease, and sequelae, what is the end of it? As a result, the effect, what happens to this patient? So here there will be reduction in the diffusing capacity of the carbon dioxide. So carbon dioxide cannot leave your body, and at the same time oxygen can come in not the maximum or ideal amount. The lung volume can be reduced because of the lack of expansion of the alveoli, and hence the whole lung compliance is reduced. So your lung function, your lung capacity is being compromised. And what do you see on X-ray? You will do this in your clinical year. You find that instead of nice see-through lungs like this, the top part, it is supposed to be radiolucent. Your lungs are radiolucent. The X-ray passes through, but you see some areas that the radiation cannot pass through. So these are the areas that are already diseased. Okay? They can be fibrotic. They can have some kind of inflammation, or maybe even fibrosis. This is a big part to understand the pathogenesis. How does this occur? I'm talking about the pathogenesis in general, okay, in this group of disease. So there are many causes which I will list down after this. So in general, what happens if you are exposed to certain things, and what will happen to your lung once you are exposed to this certain causative agents. So what happens here, I'll show you the picture after this. The first manifestation will be inflammation, alveolitis. So you've learned about inflammation. That's the whole reason for learning one whole topic on inflammation. So now you're applying to the respiratory system. So alveolitis is inflammation of the alveolar wall, where the interstitial will accumulate inflammatory cells, all the other cells, effector cells, and these will be in the interstitial. So they start in the interstitial, and then when they come, they will release all kinds of mediators. The mediators are the destructive ones. So the mediators will cause injury to whatever cells that are around. To your, what are the cells in the interstitial? First you have the pneumocytes, and then you have the endothelial cells of the blood vessels, of the capillaries, and you have all the other supporting cells. So what is critical here is injury to the pneumocytes and the endothelial cells. So these are the very important cells that has to be intact for your lung to function properly. So the pneumocytes and the endothelial cells of the capillaries. So here, eventually there'll be inflammation, fibrosis, and the fibrosis will go around the interstitial, in all the interstitial surrounding the alveoli. So you end up with a common final pathway, which is honeycomb lung or end-stage lung. So, okay, we go through this, right? So you won't find this in the textbook. These are the alveoli. Initially, you get injurious particles. So these injurious particles will be listed in the causes. Okay? So whatever the causes are, the particles are the injurious particles. So they get into your lung, they go into the interstitium, and they are engulfed by macrophages, and you get inflammation. So the macrophages will release all kinds of leukotrienes, and they attract all the inflammatory cells, lymphocytes, neutrophils, even fibroblasts to come in. So this will cause alveolitis. So here you end up with alveolitis. Now this is the beginning, right? The beginning. And afterwards, when fibroblasts starts coming in abundance, these yellow ones, fibroblasts, they come in here. Fibroblasts will come in whenever there is inflammation. They want to repair. They want to replace those cells that have been destroyed, living spaces. So they want to come and replace with collagen. So fibroblasts will come and deposit collagen, produce collagen. So you have collagen deposition. The collagen will mature. The fibroblasts will mature to become fibrocytes, and this is called fibrosis. So once there is fibrosis, the lung cannot expand properly. Alveolar spaces will be blocked. So exchange of gas, exchange of carbon dioxide and oxygen from the capillaries will be blocked. So this is where your lung is not functioning properly. And eventually you end up with honeycomb lung. You know what is honeycomb?
Yes.
Okay. Pernah makan kan honeycomb? Yeah. So you end up with honeycomb lung. So eventual, or the very end of it, the complications will be secondary pulmonary hypertension, because the blood vessels are being constricted, being destroyed, so the tension of the vessels will increase, and this happens in the lung. So secondary pulmonary hypertension, and with the secondary pulmonary hypertension, so the blood from the where is the blood coming from into the lung? Right side of the heart. So eventually there'll be accumulation of blood in the right side of the heart, which will lead to heart failure. Yeah? And this condition, when related, heart failure related to problem in the lungs, they are called copulmonale. Okay? Are you following? Yes. This is honeycomb. So that's where the honey produce, the honey capped. So your lung will be just like a honeycomb. Yeah? So no room for expansion. So these are the conditions that will lead to what I have said just now. So you just need to know that we just divide them into fibrosis, because some diseases they will cause fibrosis. Some injurious agent will form granulomas. Some will attract eosinophils, like in allergic condition. Some are smoking related, and some are due to accumulation of some protein material. Okay? So these are the conditions that can lead to what I have explained just now. Yeah, follow? So now, of all these, the commonest will be pneumoconiosis. Pneumoconiosis, sarcoidosis, these are the common things. And the pneumoconiosis includes different materials. Pneumoconiosis means tiny particles going into your lung causing problem. So we will go into pneumoconiosis. When you say the word pneumoconiosis, it means that it is non-neoplastic. It is not a tumor. It is a condition that reacts to something that you have inhaled. And what you have inhaled are things from where you are exposed the most. And the commonest will be someone working in a place being exposed to the same material day in, day out. Yeah? So the diseases can be induced by organic or inorganic particles, chemical fumes, vapors. So whatever comes into your lung that can induce problem, these are the injurious agents. The development of pneumoconiosis greatly depends on how much the lung has inspired in the material. So how much have you been exposed to that material? So the amount is very important, the concentration, how long you've been exposed, and how well your lung can clear. But if you are exposed every day from morning to evening, it's quite impossible for your lung to cope, to try to remove all these particles. So if you're exposed occasionally, then it's easier for the lung to clear. Secondly, the shape, the size, the bouncing, the buoyancy of the article, how much it can bounce. So the particles that are tinier will be most destructive because they shoot right straight into your depth of the lung and into the onto the pleural surface, pleural cavity. So the larger particles will tend to go slower, they bounce slower, and the small particles tend to be more bouncy. They can go faster. They hit the wall, they bounce again. So the most dangerous of all these will be tiny particles like silica, quartz, asbestos, this beryllium. These are very tiny particles that will spread all over the lungs, even in small amount. Now, of the pneumoconiosis, of all these conditions, the injurious agents that I will go into will mostly be carbon, asbestos, silica, beryllium. Yeah? So this one is co-workers pneumoconiosis is exposure to carbon. When you work in a coal mine, you are exposed to the carbon. You are urban dwellers. You live in the city. You are exposed to fumes from the city. You also have some particles in your lungs, but you can cope with it because the fumes are very mild, and you're not working by the roadside. You're working indoor. So, if at any point we look into your lungs, you do have carbon particles. That's normal. Um, This is called anthracosis. Okay, remember the terms, yeah? Anthracosis. Okay. You all have anthracosis. Then secondly, the simple CWP, co-workers pneumoconiasis. These are in co-workers. They are miners. They work in the mines, in the coal mines. They tend to have much more of this coal, of this carbon deposited in their lungs, but they may not have worked long enough, so their carbon particles are a lot, but not enough to cause problems in the respiratory system. So these are tiny macules, and if you look at them, they contain macrophages containing the carbon that has been engulfed from the coal mines. Then the worst spectrum is the complicated CWP. Here, if you have worked in the mines for 40 years, 30, 40 years, yes, your lung contains a lot of carbon particles, and what will happen will be the same as I described to you in the beginning. Okay? So the process will lead to fibrosis of the interstitial. So here, the lung function will obviously be impaired. The second common particle is silicosis, silicon particles. So silicon particles, silicon are being used in all kinds of gadgets. So silicosis is also obtained from natural products. So people who work in certain mines or certain conditions, they do get silicosis. So here, the fibrous nodules form concentric layers like this, and there are particles of silicon inside, confined in this area. And if you polarize under the microscope, they are birefringent. Okay, they shine under the microscope, and they form thin shell around, very thin calcified area around, which is like the eggshell. So this one can also progress to fibrosis. Beryllium is another material, it's an alloy. This can also lead to granuloma formation. You've learned granulomas, yes? So they form granulomas, and they can cause fibrosis of the interstitium as well. Asbestos. Are there asbestos up here? Kan? Asbestos. All the lining are asbestos. As long as they are intact, there's no problem. There will be no asbestos dust flying around. So the problem is making the asbestos, the factory making the asbestos. So they used to be to take female workers to work in, because the asbestos are beautiful, fine like silk. At that time they still didn't know the problem with asbestos. So the ladies are happily working in this. Just it's nice to touch the asbestos. So, but now the men will be working in asbestos. So without wearing masks, that's dangerous. So now they have new gadgets where they wear like the capsule and protective clothes when they work in asbestos factory, because it is so dangerous. This is the worst occupational disease that will cause fibrosis, pleural effusion, lung carcinoma, mesothelioma. When you do the neoplasm of the lungs, you will learn about this. Yeah. So asbestosis is one of the dangerous material that can cause lung carcinoma and mesothelioma. What is mesothelioma?
Oh, mesothelial.
Tumor of the
Mesothelial.
Mesothelium. Where are the mesothelium? Where do you find mesothelium? Mesothelial cells? Oh, balik. Baca anatomy balik ya. Histology ya. Before neoplasm lecture. Okay? Where are the mesothelial cells? Asbestos related disease, you find that these asbestos, they are so tiny, 100 to 200 microns. What they do is they go into the lung. Along the way, they collect iron and protein material wrapped around them, nicely wrapping around them, and they form strong, tiny particles that will carry them right through the lung into the pleura. And these bodies are called ferruginous bodies. They are called asbestos bodies. So you see them in macrophages in the lungs, and they are there to stay. No way that you can remove these asbestos bodies. So they cause fibrosis, they cause pleural effusion, they cause lung carcinoma, and if you are a smoker, it can enhance the condition. The condition gets worse. Yeah? And your development of carcinoma your development of lung cancer will be much faster if you have asbestos with smoking. You okay? Are you following?
Yes.
Have you heard of Tutankhamun? Yes? Who is Tutankhamun? Yeah, Pharaoh, right? One of the pharaohs. He is the richest, discovered most recently, and this is his all his treasure buried with him. And this seat is made of solid gold. So they're all solid gold. So they are now tracing the more materials that are related to him, and plus some kind of disease. So these are the secret agents. It's the Ramses, or the Ramses there in the Valley of the Kings. We said that now our tour group has got intellectual people, 12 of us, and we need a good tour guide. So they gave us an archaeologist as our tour guide. So we learned a lot from the tour guide. So if you go touring, make sure you ask for a good tour guide. Are you ready for the next one? So initially, I showed you the interstitial that contains a lot of vessels, a lot of capillaries. That's where you get the most capillaries because the body will take up oxygen in the lung and carry it to the capillaries. Yeah? So anything that disrupts the function of the capillaries will disrupt oxygen carbon dioxide exchange. So that's the basic thing to remember. So what can happen to these vessels, to these blood in the vessels, or the vessel wall itself, you have, if there is a problem, then there is going to be edema. So what kind of edema do you get? Yeah, there are edemas that are hemodynamic. You either increase what pressure? Hydrostatic pressure, or you reduce oncotic pressure. So remember that basic, if you apply this basic knowledge, then edema anywhere is the same. So here in the lung, it is the same. You increase hydrostatic pressure in case of left heart failure. Where does the blood go to after the lung? Which? Left heart. Left heart. So if you have problem with the left heart, then the blood will be static in the lung. So heart failure. Mitral stenosis. Where is mitral valve? Okay. So when there is stenosis, there is going to be back pressure. And then volume overload, of course. It's volume overload in the heart, then there will be back pressure. So this will lead, the pressure, the increased hydrostatic pressure will lead to leakage of the fluid outside the vessels, out of the capillaries. So you get edema. Then when there is reduced oncotic pressure, when you have lack of protein in your blood, oncotic pressure are the pulling pressure. So you lack oncotic pressure, there is less pulling of fluid. As in nephrotic syndrome, liver disease, protein losing enteropathy, you will learn this in GIT later. So this will cause edema. Then the problem, another problem is the vessel itself. Something happens to the vessels. Imagine millions of capillaries in the lung that are being destroyed at the same time. What will happen to you? So when there is vascular endothelial injury, or any kind of infection that will cause destruction of the endothelial cells, like virus, high oxygen, or even aspiration of some acid, paraquat for suicide. People want to commit suicide, they drink paraquat. So this will cause sudden destruction of the lining or the endothelium of the blood vessels. So that will lead to leakage. When there is leakage, there is edema. Right? So edema in the lung is no joke. Instead of being airy and fluffy with a lot of air, you get fluid in the lung. It will look like the liver. It's heavy. So this is how it looks like, the liver. It looks like the liver. So the lung is like a solid mass rather than the nice. Pernah tengok kan paru-paru, you all makan tak? Tak makan paru-paru? Oh, you're missing That's the best part. The which has the most toxic material. But you cook them kan, sedap kan. So you see paru-paru, kalau you rebus di telur angin, it's very light, airy. But this one is solid because it's edematous. It's got fluid instead of air. Under the microscope, you find that all these capillaries are being destroyed, and fluid, protein from the blood will ooze out, and they can even go into the alveoli. So they block the alveoli. The alveoli becomes, instead of air, they contain some proteinaceous fluid. So this is pulmonary edema. Maria, Nuri, gula-gula. Good, just keep your eyes open. Okay? Don't sleep. Buatlah apa pun. Aku tidur sebelah cubit. So when you have these hemorrhages, of course the macrophages will engulf all this blood, and they will break down the blood and find hemosiderin inside the macrophages. These are called hemosiderin-laden macrophages, and it's a diagnostic of heart failure. Heart failure cells leading heart failure leading to edema. Clinically, patient will have dyspnea, they cough with frothy sputum because there's a mixture of fluid and air, so the sputum becomes frothy and they can't breathe properly, they get hypoxemia, they can easily get secondary infection. So, like I said, there'll be fine crackles in the lung when you auscultate, bubbling sound. ARDS is a condition, is an acute condition. It's called shock lung. It's short for acute respiratory distress syndrome. And here you have diffuse alveolar damage. Okay? So this is due to the damage to the capillaries. Okay? Diffuse damage in the capillaries of the interstitial. What causes all this? What are the causes of ARDS? Infection, the latest COVID-19. Yeah. So you get COVID-19 being hospitalized, meaning that they have ARDS. So they need oxygen. They need to be put on the oxygen support. So others will be any kind of infection that comes in through your blood, sepsis, as in when you are in the army, you get leg injury, and the leg injury will be exposed to some bacteria in the soil, so you will develop sepsis, and this kind of people who have got injury during the time of war, when antibiotics are very difficult to get, they will go into ARDS. Okay? They will go into sepsis and ARDS. The booby trap, that booby trap, when it traps your foot, it will puncture, this sharp thing will puncture your leg, and they introduce all this bacteria from the soil. So that is one technique of getting rid of enemies. So they make sure that bacteria gets into the system and kill the army off. Okay? So these booby traps. So other physical injuries, trauma, fractures, burns, all these I'm sure you know. So all these are the other things that can cause ARDS. You can read that. So what happens, what is the pathogenesis, which is very important. You're walking out on the most important part. So pathogenesis of ARDS, they are acute alveolar injury. They can be caused by so many mechanisms, so many injurious agents. And what happens here is, once you get ARDS, you go through respiratory failure, and there is damage to the endothelium and the epithelial cells. I will show you the picture. See, you get injurious agent. The injurious agent will of course elicit inflammatory reaction. Then you get inflammation. When there is inflammation, there will be mediators, cytokines, complement fixation, complement cascade. Remember your complements at cascade? Okay, apply it now. So they will start to damage the blood vessels. So once they damage the pneumocytes at the blood vessels, the capillaries becomes permeable. The blood can lift the capillaries. Anything can, especially the fluid, especially your serum, fluid in the blood, they can go out of the capillaries into the interstitial. So now you have early damage of the pneumocytes and the capillaries. Next, the blood leaves the capillaries, so you have accumulation of blood outside the blood vessels. Then you have the alveolar wall being destroyed as well, and the fluid will go into the alveolar space. Okay? So from the interstitial, they go into the alveolar space. So now everything contains all this edematous fluid, or fluid. Even the blood can go into the alveoli. Macrophages start engulfing the red cells, and then this protein-rich fluid will accumulate inside the alveoli. So mixture of protein fluid, protein-rich fluid, dead cells, they form a kind of pseudomembrane, a kind of membranous material that will further block the alveoli. Okay? And the alveoli will be heavy and boggy, the lung will be heavy and boggy like this, very heavy lung. And here there is a lot of congestion, blood. If you look at it under the microscope, you find that that's the hyaline membrane. We call it hyaline membrane. So the protein and the dead cells form the hyaline membrane. Once they form the hyaline membrane, they are going to block exchange of oxygen and carbon dioxide. And the interstitial will be congested with fluid, blood, inflammatory cells, and the interstitial becomes thick. See, if you compare to this, very thin, now it is thick. Interstitial are thick because they contain all kinds of dead cells and fluid and edematous fluid. Okay? That is one feature, widening of the interstitial. So ARDS is rapid. The rapid onset and life-threatening. So once you go into this condition of ARDS, you have to support by ventilator. If you are outside the hospital, if you are in the remote areas, there's no way you can survive ARDS. So they have to be in the hospital for oxygen therapy. Even so, the oxygen therapy can be refractory. They don't respond to oxygen therapy, and this is when 34 to 46% of ARDS will die. Okay? That's the mortality rate of ARDS. So that's why you see in COVID, there are deaths as a result of COVID because of the ARDS. I think we're quite good. We finish it. Yeah. So you have time to eat. I was rushing a bit. Are you all okay?
Yes.
You followed?
Yes.
Okay, good. This is in Santorini. It's an island in Greece. So this is where you want to go for your honeymoon, okay? So choose the right partner. Any failures in your relationship, just drop it. Think for 1 week maximum and forget it. Yeah? It's done for. Don't waste your time over something which is not worth it. Go back to your studies and focus on your studies. So there is always someone waiting for you. Remember. Yeah? So all the best. Thank you. Yeah, we go quickly. Is it okay? Okay. So we'll do pulmonary embolism. Pulmonary embolism, where do they come from? They come from the deep vein of the leg. Okay? The deep veins of the leg, especially when you are at an older age and you travel and you sit down and you sleep on the chair in the plane for hours, you allow the vein, the blood to get, your vein to get thrombosed. The moment you get out, it travels straight to your lung and block it and cause saddle embolism. So this will block the lung completely and cause immediate death. Okay? That's when you see that someone after operation, they're happy getting up from anesthesia. They sit down, and after a while they just drop dead because the embolus has traveled to the lung. Okay? That's why it's important to mobilize your patient immediately after surgery. The moment he gets up, he wakes up, get him out of bed and mobilize him. Yes, to prevent this deep vein thrombosis. In case of tiny emboli, they will go right through the parenchyma into the lung, okay, and they go to the end of the lung and they tend to form this V-shaped, wedge-shaped infarct. Okay? So if you follow the branches of the vessels, they are spreading like that, branching, so the infarct will be like wedge shaped. So these are due to tiny embolism. It goes to the lung. So if you have embolism, it can appear to be like myocardial infarction, chest pain, dyspnea, and you feel like you're having heart attack, but you die faster than a heart attack. So this, if you have small emboli, then probably you just feel the chest pain, and you get some cough with hemoptysis, and you will survive. Right? You will survive that tiny emboli. If the emboli are multiple and the types of embolism, have you learned? Yes. Embolism, types of embolism. What are they? Air, fat, foreign body, thromboembolism. One more. Kurang beranak. Kurang beranak. Amniotic fluid embolism. Okay, that is the fastest cause of death. Amniotic fluid embolism causing maternal death. So the amniotic fluid gets into your blood vessel, they travel very fast to the lung and they cause death on the table, okay, during delivery. So these are multiple embolism. Even from your fat from broken legs, you get fat embolism. Where do you get air embolism? When? Which people? Divers. Okay? The divers get air embolism. These are keywords you have to remember, okay, for your MCQ. Okay? Learn through keywords. What is present in this, not present anywhere else. So these are the keywords. Eventually, pulmonary hypertension. So you know that maybe you don't know it, the blood pressure in your lung is 1/8 the pressure of the system. Right? I'm sure you've learned in physiology, but you've forgotten, definitely. So it's 1/8 the systemic pressure. That is the pressure in the lung. And These are usually caused by related heart and lung. There is a related heart and lung condition. So usually you get pulmonary hypertension due to problems in the heart, and the either increased blood flow or increased pressure in the vessels of the lung, or you like increase resistance in the lung. Maybe some vessels in the lung are fibrosed due to certain conditions. So the other conditions that we have done in interstitial diseases will all cause pulmonary hypertension because they create problem in the interstitial, creating the increased tension in the blood vessels. So you get increased pressure in your pulmonary tension. Right? So these are the causes. You just need to think. You're here to think, kan? Not to just swap, kan? Think. So if you think, the lung, what are related to the lung? The interstitial. What are related to the blood vessels? Interstitial. So any problem in interstitial, you get problem with tension. If you have congenital heart, some blockage somewhere, the effect will be on the lung, the tension in the lung. Embolism, like we said just now, if a lot of emboli going to the lung, then they create blockage and increased tension. Only a minority have got some idiopathic or inherited disorder. Minority, which has got certain types of mutation. Others boleh fikir. Autoimmune, anything that destroy some tissue, and that will cause problem in the vessels, like vasculitis. Eventually, I think this is the end. So these are the houses on the islands. They are all on steep, on mountains and steep. They go down. So the only way to renovate your house is by using donkeys. So the donkeys will carry the things up. But you all have to be adventurous, You all have to go trailing and mountain climbing, not just sit and study, exercise every day. Go out to play. Make sure your feet touches the ground every day, so that any excessive electrons will leave your body. You don't get static. Ni nak pakai tudung pun tudung layang. Static kan? Betul tak? So a lot of static electricity inside you. Touch the ground. Yeah? Okay, that's all. So see you when I see you. Fast food after this, yeah? Puasa pagi tu tak apa juga. I'm sorry I have to change the lecture to today. I have a meeting on Wednesday. So these topics are the most difficult topics in the pulmonary system. So if you can go through these topics, you'll be okay in the rest of the topics. Yeah? So focus and try to understand the big picture, the concept. So my first advice is never ever inherit your senior's notes. Never do that. Yeah? And you have to read the textbook, because there's a lot of mistakes which has been doubling since senior years. Same mistakes by students in their answers, which means that you have corrected your senior's notes. So don't ever do that. Okay, so the topics today will be vascular and interstitial diseases. Do you remember your anatomy?